Hello guys, welcome to our channel again today. The channel is Nazvin. Kindly, I want to welcome you that you get to subscribe to us, and that is the best way in which you can always support us by subscribing. You let many people get what we discuss here in this channel, and you also get by liking the video, you get also YouTube to recommend us to more population, so that they may understand what really happens in the channel. So guys, today we have a very interesting topic. Today we're going to talk about a very special thing which is with us. So we are going to talk about something we call blue balls. Blue balls, that is what we're going to talk about, guys. I don't know if you have ever heard of blue balls. So guys, I want to encourage you to sit back and also watch this. So blue balls, medically they are referred to as the epididymal hypertension. So it's a condition experienced by some men when they have prolonged sexual arousal without ejaculation. So this condition is characterized by discomfort, aching in the testicles due to increased blood flow, and also pressure in the reproductive organs. So the blue balls is also called epididymal hypertension, where some men may have a prolonged sexual arousal without ejaculation, and this brings about discomfort and aching in the testicles due to increased blood flow and also pressure in the reproductive organs. So what causes this? That's what we're going to talk about, or what you call etiology in medically, what you call etiology or the causes. So epididymal hypertension, commonly known as blue balls, is caused by prolonged sexual arousal without ejaculation. And when you look at the detailed etiology, we talk about physiological mechanism or how it comes about. Number one is increased blood flow, which is through the arousal or sexual arousal triggers in the autonomous nervous system, increasing blood flow to the penis and also the testicles. This blood engages the erectile tissue and also leading to erection. So engorgement also comes about with this. The increased blood flow also causes the testicles to swell and the scrotum to tighten. So number two aspect is about lack of ejaculation, where we have retention. If ejaculation does not occur, the blood remains trapped in the genital area, maintaining high pressure. So when the pressure builds up, the engorgement and lack of release increase the pressure in the testicles, and also discomfort comes about, or the pain. So also we have hormonal factors, especially when we talk about testosterone. During the arousal, testosterone levels can contribute to increased blood flow and also the sensitivity in the genital area. So prolonged arousal without ejaculation does not significantly change the testosterone levels, but can contribute to the sensation of discomfort. And on the aspect of neurotransmitters as etiology, the dopamine and other neurotransmitters involved in the sexual arousal can contribute to increased blood flow and tension in the genital area. So the release of these chemicals without a resolution of ejaculation can lead to symptoms of the blue balls. On the psychological factors, the expectations and frustrations can be another aspect, where the psychological anticipation for sexual release and also subsequent frustration when it does not occur can exacerbate the physical symptoms. So stress and anxiety builds up, and also because it's related to sexual performance on a complete sexual activity, can contribute to the perception of discomfort. Other contributing factors, the frequency of sexual activity. Infrequent ejaculation can lead to buildup of seminal fluid and increased pressure during the arousal. Regular sexual activity or masturbation can help reduce the occurrence of blue balls by maintaining a more consistent release or pressure. Prolonged arousal is also another aspect, where situations where arousal is prolonged without the opportunity of ejaculation can with extended foreplay or interrupted sexual activity are more likely to cause what we call blue balls. On the differential diagnosis, it is important to differentiate blue balls from conditions that can cause testicular pain, such as testicular torsion. And guys, if you have not watched our video on testicular torsion, I did a detailed video on testicular torsion. Kindly, I want to request you to go back and watch that video. It is really informative, so that you get also to understand what testicular torsion really what it really means. So when we talk about testicular torsion, is a medical emergency, like we discussed it there, where we have spermatic cord twisting, cutting off the blood supply to the testicle. It causes severe pain and requires immediate surgical intervention. Also, you have to differentiate with the blue balls from epididymis, epididymitis. So that's inflammation of the epididymis. So often this comes about because of infection, and so normally it causes pain, swelling, and redness of the testicular area. Varicocele is also another thing which you look at, and when you talk about varicocele, we're talking about enlarged veins within the scrotum, which can cause a dull ache and also heaviness. Also, hernia is also another aspect which you need to look at. Inguinal hernias can cause pain and swelling in the scrotum, similar to the discomfort felt with the blue balls. So the etiology of the blue balls involves a combination of physiological and psychological factors related to prolonged sexual activity without ejaculation, increasing the blood flow to the genitals during arousal, and this one can cause a lot of issues at some points, where you get coupled with lack of release, you get it leads to pleasure buildup and also discomfort. So understanding these mechanisms can help an individual manage and prevent conditions effectively. If testicular pain is persistent or severe, it is very important that you get to consult your healthcare provider to rule out other more serious conditions. How do you manage the blue balls? Management of blue balls or epididymal hypertension focuses on relieving the discomfort and also preventing recurrence. And here are the key strategies which are employed. Immediate relief, especially ejaculation, is number one thing which we look at. And the most direct way to alleviate this discomfort is through ejaculation, which can be achieved through sexual encounter or masturbation. So effect of this is that ejaculation helps to relieve the build-up pressure and reduces the blood flow to the genital area, thereby alleviating the discomfort. Cold compress is also a way of managing it, where you apply a cold compress or ice pack on the scrotum for 15 to 20 minutes to relieve that one. This can help to reduce the blood flow and also the swelling, also providing relief from pain. Distractions techniques, where you involve one in activities which are non-sexual, engage in non-sexual activities that can distract the arousal, such as reading, watching TV, or spending time with friends. The effect of this, it reduces the focus and also the sexual arousal, which can help lower the blood pressure in the genital area. Exercise is also another aspect which as a form of managing the blue balls. So light exercise activities such as walking, jogging, stretching can help direct the blood flow, redirect it from the genital area to other places when you do that kind of exercise. Long-term prevention of this is regular ejaculation, engage in regular sexual activity or masturbation to prevent build-up of pressure. So the effect of this is that consistent ejaculation helps maintain balanced blood flow and reduce the likelihood of experiencing the blue balls. Avoiding a prolonged arousal, the strategy employed there is to try to avoid situations where arousal is prolonged without an opportunity to release. The effect of this, you limiting the extended periods of arousal can help build up of pressure in the testicles and at the end of the day manage it. Psychological management, we talk about stress reduction techniques. So you practice things like deep breathing, meditation, or yoga to manage stress and anxiety related to sexual activity. The effect of this, it reduces the stress, which can help manage the psychological aspect of arousal and also discomfort at the end of the day, guys. Counseling is also another way of managing it, where support is very key. If blue balls can cause significant psychological distress, consider seeking counseling or therapy to address the underlying emotional issues. With this, the professional support can provide strategies to manage sexual health and also overall well-being. Medical evaluation is also another thing where you consult your healthcare provider, where you need to see your doctor if the discomfort persists, out other conditions that might be similar with the symptoms, so that to make a proper diagnosis. If we have symptoms like severe pain, swelling, or redness, seeking medical advice immediately, so that your doctor or your healthcare provider can make a differential of things like testicular torsion, epididymitis, and also varicocele, as discussed above. So, on management of the blue balls, it involves both immediate relief measures and long-term prevention strategies. So, regular ejaculation, avoiding prolonged sexual arousal, and utilizing cold compresses and also oral distraction techniques can effectively manage the symptoms. If the discomfort persists or concerning symptoms arise, consult your healthcare provider for essential to rule out more serious conditions. Balancing both physical and psychological health plays a crucial role in managing and preventing the occurrence of the blue balls. So sometimes we have complications related to blue balls or the epididymal hypertension. Typically, blue balls do not lead to serious complications. However, there are some potential issues you need to be aware. So physical complications, especially, it is very painful. Pain is a complication of this. So that is what we also look at. So the duration of this is prolonged discomfort or pain, though generally mild and temporarily can be very bothersome. So management of this is regular ejaculation, and relief measures can prevent the persistent pain. Number 2 is about potential misdiagnosis. Other conditions such as testicular torsion, epididymis, and varicocele may be mistaken for blue balls. So that is also another way. So seeking medical advice if pain is severe, persistent, or accompanied by other symptoms is very crucial. Psychological complications, anxiety and stress. So the emotional impact of this is that the discomfort and a lack of understanding about the condition can lead to anxiety or stress. The management of this is about educating oneself about the condition and discussing the concern with the healthcare provider or therapist to alleviate the anxiety. Embarrassment or the shame can also be there, especially with the social stigma. Men may feel embarrassed or ashamed about discussing the symptoms, leading to social withdrawal and also subsequently reduced self-esteem. With this, the support needed is about open communication with the partners or seeking support from the counseling, which can help alleviate these big feelings. On the impact of on social health, on sexual health, avoidance of sexual activity is one of the things which can be also a complication of this, where one changes the behavior. Some men might avoid sexual situation to prevent the discomfort associated with the blue balls, which can affect their sexual relationships. The solution for this is understanding the condition is temporary and managing it appropriately, and which can help maintain the healthy sexual life at the end of the day. While the blue balls are generally not associated with severe complications, the discomfort can have physical and psychological impacts if not properly managed. So regular sexual activity, proper education about the condition, and also seeking medical advice when very necessary is key to prevent and manage these potential complications. So maintaining open communications and also addressing any psychological impacts is also very important for the overall well-being of an individual. So on the how can we prevent blue balls? Preventing blue balls or epididymal hypertension involves strategies to manage sexual arousal and also reduce the likelihood of prolonged discomfort. Some of the effective preventive measures you can take is, number one, we talk about regular ejaculation. So engaging in regular sexual intercourse or masturbation is very key. So regular ejaculations help to maintain the blood flow to the genital area and also reducing the buildup of pressure and also preventing discomfort. Managing arousal is also another thing where you avoid prolonged arousal. The strategy about this is try to avoid situation where sexual arousal is extended without the possibility of ejaculation, such as prolonged foreplay without follow through. So this prevents the accumulation of blood and pressure in the testicles. Distraction techniques is a way of preventing this also, where you engage in non-sexual activities. Distraction techniques is also very key, where you engage in non-sexual activities, so such as which divert your attention from sexual arousal, such as the exercise, hobbies, or spending time with friends and family. So the effect of this is reducing focus on sexual stimuli, which can help lower the arousal levels and also discomfort. Stress and anxiety management is also another thing which you can employ. So relaxation techniques, when we talk about this, we talk about breathing exercises, we talk about yoga, we talk about meditation. So or progressive muscle relaxation into your routine. This can also help you relax, especially manage your stress and anxiety, which can help control the arousal levels and prevent psychological factors from exacerbating the condition. Open communication is very key also, where you discuss with your partner through communication, with open conversations with your sexual partner about the need of regular ejaculation or ways to manage arousal at the end of the day. This can help create supportive environment, minimize prolonged arousal and also discomfort. Medical and psychological support is very key, where you seek professional advice. Healthcare providers, they are very key in this. If you frequently experience this discomfort, consult your healthcare provider for advice and also to rule out other underlying conditions such as epididymitis and also varicocele and testicular torsion, so that you get the right management over the same. Therapists or counselors can also play a very important role. For persistent psychological distress related to sexual health, consider seeking help for mental health professionals. So physical activity is very key also, where exercising regularly, routinely, regular exercise regimen that include both cardiovascular and strength training exercises, they promote overall circulations, and they can help manage arousal levels. Environmental factors limit exposure to sexual stimuli, like in the media and also situations. Be mindful of exposure to sexual materials, where explicit materials or situations that may lead to prolonged arousal without release. The effect of this is that it can help you avoid unnecessary build-up of sexual tension and also pressure. So preventing blue balls, guys, involves a combination of regular ejaculation, managing arousal, and also adopting healthy lifestyle habits. By understanding these triggers and employing strategies to balance sexual health, individuals can effectively prevent the discomfort associated with this condition. Open communication, stress management, and seeking professional advice when needed are very crucial components in the management of these blue balls. So we've talked about the differential diagnosis, how you are supposed to make that difference of testicular torsion, of epididymitis, varicocele, and also hernia, because that pain is almost related. So that etiology is very key. You can always find out what is happening so that you come up with the proper way of managing this. So management is especially on ejaculation. The most straightforward way to relieve the discomfort is through ejaculation, which can help reduce the blood pressure and also alleviate the symptoms. Cold compresses are very key. Applying cold compresses on the scrotum can reduce the blood flow and also alleviate the pain. Distraction techniques, engaging in non-sexual activities or distracting oneself to help reduce the arousal and discomfort over time is very. Exercise, light physical activity can redirect the blood and reduce the symptoms at the end of the day. Relaxation techniques also are very key, where you get deep breathing exercises, yoga, and also physical and also emotional aspect of arousal without ejaculation. So prevention, part of it is preventing it is regular ejaculation, avoid prolonged arousal, and when you see when to see a doctor is very key also, where when you have persistent pain or when you have severe symptoms. So like in persistent pain, if the discomfort or pain persists even after ejaculation or other self-care measures, it is important to see a healthcare provider to rule out other conditions such as testicular torsions or infections. When severe symptoms occur, if pain is very severe, sudden, or accompanied by other symptoms like swelling, redness, or fever, is very key to seek your medical attention so as to could indicate more serious conditions at the end of the day. So blue balls is relatively common and typically harmless condition resulting from prolonged sexual arousal without ejaculation. The discomfort can be managed with ejaculation or other self-care measures, that's masturbation at the end of the day. However, if symptoms persist or are very severe, it is important to consult with the healthcare provider to rule out more serious issues. Understanding the causes and the effective management strategies can help alleviate the concerns related to the condition. Guys, welcome. The channel is Nazwin. That's about the blue balls. Kindly like the video, and when you like the video, you get more people, YouTube to recommend us so that more people can watch that basic information as this about the blue balls and also others as stated in our channel. If for any comments, kindly give those nice comments down below. For any support, kindly, we have our details in our we have our number, or we have our M-Pesa number there where you can reach us. We have our email there. We have our PayPal account there where you can also share your support to us. Guys, we're on the road to 10,000 subscribers. Kindly, I want to welcome you to the channel and also welcome you to the next video. Guys, welcome. We love you very much, and bye.